Hi, hello, Miss Yoga Malar. I'm Nitya Chandrasekharan. My student card number is 2019100040018. So I'm here to talk about assignment 3 is speaking skills. So definition of drugs abuse and its statistic in Malaysia. Introduction of drug abuse is not just a problem of the individual. Factors that contribute to drugs abuse come from all levels, from the individual perceptions to addiction to the economy of their environment. Definition of the drug abuse. There is several ways to define the term drug abuse, but the main concept is about non-prescriptive consumption of certain substance. For example, is drug that can be give certain effects to an individual, in which the chronic use of the substance may lead to physical and physiology dependencies. Statistics of drug abuse in Malaysia. Drug abuse has been most complex social problem faced by the country. The community involvement with drugs was not abundant by age, environment, and groups, either poor, rich, professionals, labor, public servants, or students. The range of effect of drugs that we can start from and to. So for example, I give one example is for depressant to pacing out, relaxations to loss of their body control, lowered inspirations to stupor, and reduction of intensity of physical sensations to several depression of respirations, and digestion upset to possible death. And the more effects is somatic effects, an increased heart rate, dry mouth, cotton mouth, reddening of the eyes, or reduction in intraocular pressure, or muscle relaxations. Okay, pronadrol use large amounts. They can cause amnesia, confusion, drowsiness, and personality changes. Then how the alcohol will affect drugs is one certain, and this is how about the alcohol. Alcohol can attend the brain. First, the alcohol affect the full of brain as well as motor, coordinations, and decision making. Second is then alcohol knows the mind of brain, and we can lose control over emotion and increase the chances of blackout. Third is finally the alcohol breaks of the brainstem, and as it affects heart rate, body temperature, and appetite, and concentration, and dangerous and potentially fatal conditions. Investigation of the drug or alcohol. A toxic screen refers to various tests to determine the type and approximate amount of legal and illegal drugs a person has taken. How is test and performed? Blood or urine sample. However, it be done soon after swallowing the medication using stomach content that are obtained through or gastric or after vomiting. How long after usage can drug can be detected? There is no simple answer for these questions because it depends on certain itself, dosage, frequently of the of abuse, individual rates of drug and metabolism, and excretions, or at last is sensitive of the particular text carried out. Method of the treatment. There are three major areas in the rehabilitation program. First, detection of and reductions. Second is rehabilitations and the institute. Or third is supervisions in the community and follow-up care. Okay, the component of completion drug abuse treatment. They have many ways. Child care service, family service, housing and transportation service, financial service, legal service, HIV and AIDS service, educational service, medical services, and mental services and vocational services. Outpatient drug rebates and drug treatment center also the one treatment that can reduce the control of the alcohol or drug usage. A wide range of treatment modulation including program slowing up group or talk therapy inside or intern physical and behavior and 12-step more losing structure depending on individual patient and characteristics. So I have come to the end of my presentation. In summary, I was spoken about drug abuse in Malaysia. So no drugs can be get happy life. So finally I done my assignment. Thanks Miss Yogamala. Thank you.